Hi everyone, welcome back to my Lupus diary. This is Disha for you. I hope you all are doing awesome and are in good health. Now, today we are going to continue the topic depression and chronic illness. So, if you still have not subscribed to my channel, please do so right away and press the subscribe button. Also, hit the bell icon down there so that you always get notified with every new vlog that comes up. Now, let's start with the vlog. So, we already discussed in the depression and chronic illness blog last week about what depression is, when do we classify it as a clinical depression. If you have not seen that vlog, I am linking it in the description. Also, it will be somewhere up here, so you can always go ahead and watch that particular vlog. Now, next thing, what we are supposed to know about depression. We already know why it happens, what is wrong, right? Now, how do you rectify it? What do you do if somebody is in clinical depression that you know and is a chronic illness patient? Or you are a chronic illness patient and you are suffering from depression. Like in my case, I was the person who was suffering from depression and I had no clue whatsoever that I was going through clinical depression or what I'm supposed to do. In such cases, it is always best to talk to your doctor the minute you start getting mood flares and they become very common or very prominent. Like if you have suicidal thoughts which are coming in your mind every day, or once or twice a day, or every second day you are very low and you have major mood flares, you are very angry a moment and second minute you're okay, something which is not okay and normal with you and your behavior can be considered into a clinical depression phase. Now, in this phase, you need certain types of help. This is what we are going to talk about today. Now, what can be done? Once you talk to your doctor, they will recommend you to go to a therapist. Now, there are so many people who get scared that they have to go to a counselor or a therapist with a third person and you have to talk to them. Yes, it does become very awkward, very odd to talk to a stranger about your problems. But then remember, they're unbiased about your problems and they're not going to judge you because they actually don't know you. Second thing, they won't judge you because that is their profession, not to judge you. But yes, talking to a counselor does help if the counselor is right. If you are going to a therapist who you are not satisfied with, or you think that they cannot counsel you right, or whatever they are saying is putting you more into the depressive phase or dragging you back low and down, then don't go to such counselors. I have had good counselors also, amazing one, and I had a very bad counselor also. So, and she had dragged me into bad phase of my life. So I had one counselor who always motivated me to do best I can, and she knows whom I'm talking about. And the one who actually dragged me into really bad phase, they also know who they are. Now those type of counselors, they will be like very negative, like you know don't think you'll get this, don't think you deserve this, don't think you have to survive with whatever you have, whatever, anything negative you don't need to hear. You can change your counselor, and that as a therapy does help. So counseling from the right therapist will help you in dealing with depression to a very large extent. when I say to the very large extent, now if the counselor comes up and says to your doctor that counseling is not doing much for you, or the therapy that is you given to you is not actually working for you, then there will be a phase where you will have to go on antidepressants, which are medications given for treating depression, so that you do not harm yourself or anybody, or you do not actually end up your life. So which is very much possible in case of depression, because then you don't have that control, and a problem n size, a small problem size of ant will look like an elephant. Yes, so it will be giant as elephant, but reality, the problem is just an ant. So this is going to happen if you are into a clinical depression phase. So you have to take medications if required, or therapy will work for you and you will be better, and you will again start fighting, because chronic illness is something you have to keep fighting. It's not going to be that it's going to go away after a few months or after a year or so. It's not. And I am very blunt and clear on that. It is not. But you have to learn to deal with it. You have to get positive. You have to start accepting it. You have to start acknowledging it and be happier soon. You have to do the best you can to survive it off. And yes, there are things that changes with depression and chronic illnesses. One thing which changed for me was the amount of work I can do. I can do a lot if I am not a patient, but as a patient I can't do much. So I can work few hours, 2 hours, 3 hours, and I'm tired. I'm tired like I don't have any energies left. There were times when I used to work for 10, 14 hours as a chronic illness patient itself. But when I got a flare up or I got deteriorated, so right now I don't have the energies or strength to work more hours. I can only work 2, 3 hours. But there was a time when I could work more as a patient also, because I have been a chronic illness patient since the age of 14. That means I have only seen that phase of my strength and my ability to work as a patient. But I can tell you guys, do whatever you can in the possibility and condition. That means if you cannot work full time from office, go for a remote location job, go for a freelancing work, go for something you like, achieve your passion, drive a car, go for a bike ride, just chill, do whatever you can. If you need to earn for your living and there are restrictions on your financial conditions, then yeah, work. But work as much as your body allows you. Do not stress it out. One thing, stress is worst thing. And before you start with any therapy or you go for any medications for depression, talk it out. Yes, guys, talk it out. Talk it out to anybody. Talk it out to your friends, to talk it out to your family, that this is what you're going through, that you are not feeling right, that you are irritated with the fact that you are a patient, that you are not liking that there are changes in your life which are not good, or which you are not comfortable with, and you do not think that they are the way your life should be, or your life is not going according to your norm, your normal. So it is not only that you need to have a consideration and a realization that there is nothing called norm or normal. There is nothing like normal. My normal is not same as your normal. Your normal will not be same as the other person's normal. Everybody has their own bag of normal things. and nobility in their own terms. That is all. One more thing that is very important is to have empathy. To have empathy towards yourself, towards others. So if you are a friend or a relative of a patient, you need to have empathy towards them. In the same way, if you are a patient yourself, I suppose you need to have empathy for yourself, towards yourself. You need to be more empathetic. You need to be more considerate with your own condition. You need to be accepting your own problems. Yes, that is third thing. Acceptance. It is the most important part. You have to accept yourself the way you are, and 80% of your problems will be solved. Trust me, guys, I've been through, I have done it, I've gone through it. I am telling you with experience and nothing else. This is a proper patient vlog, and all that I say is only based on what I have experienced, I have done, or somebody has helped me out with. So I know that acceptance is the most important thing. A girl who had no confidence is coming in front of you guys and trying to vlog and create content which is going to help more patients like me understand their situation and accept themselves, and that is all I want from this particular channel also. So yeah, if you really are looking forward and you have nobody to talk to or not comfortable talking to anybody, let me know. I'm always around for people who need somebody to talk to. Come up, message me, DM me on Insta. Let me know your problems. We can discuss. I'm not going to judge anybody. I am an unbiased person. I will be one. And yes, I just hope you guys have an amazing day and a weekend ahead. Chill out, relax, enjoy, have fun. Stay safe, always sanitize yourself, wear a mask, be happy, stay healthy, take care.